Welcome to OET Answers.
Preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Hello. I'm Nurse Yannick Lee, and I'm here to take your clinical observations. How are you feeling today?
I'm getting well, and do not have any trouble with my hip replacement surgery. I am recovering well. Currently, I am feeling okay, except for these blisters on my lip. It's so annoying and painful.
I'm sorry to hear that. Your blisters seem to be cold sores. A cold sore is a small, fluid-filled blister that usually appears on your lip or around your mouth. It is caused by a common virus called herpes simplex type 1. Don't worry, it is not a serious condition, but it can be uncomfortable and contagious. Well, could you tell me in detail about the blisters, as you know?
Yes, sure. It started yesterday. I don't know why it came back. I haven't had one in years.
Oh, I see. Do you have any other concerns or questions about your cold sore?
Well, yes. I'm worried that I got it from the hospital.
I understand your concerns. Let me explain a few things about cold sores. It's very common and many people have it without knowing it. It usually stays dormant in your nerve cells, but sometimes it can reactivate and cause blisters on your lips or mouth.
So, you were saying I already had this virus before? How did I get it?
You could have gotten it from someone who had a cold sore or who carried the virus without symptoms. It can be spread by kissing, sharing utensils, or touching the infected area. You may have gotten it when you were a child or an adult. It's hard to tell when or how you got it, because it can stay hidden for a long time.
But why did it come back now? Is it because of the surgery?
Your thoughts are natural. It's possible that the surgery or the anesthesia stressed your body and weakened your immune system, which made the virus more active. Other factors that can trigger cold sores include sun exposure, hormonal changes, illness, or injury. It's not your fault, or anyone else's fault, that you have a cold sore. It's just an unfortunate coincidence that it happened after your surgery.
I see. But what can I do about it? It hurts, and it looks ugly.
I understand how difficult it might be for you. There are some things you can do to ease the pain and speed up the healing process. You can apply ice or a cold compress to the sore, or use an over-the-counter cream or ointment that contains an antiviral ingredient. These can help reduce the duration and severity of the outbreak if you use them early enough. You can also take painkillers, such as paracetamol or ibuprofen, if needed.
Okay, thank you for that advice. But, will it go away completely, or will it scar my lip?
Mihira, usually cold sores heal on their own, within 7 to 10 days, without leaving any scars. However, they can recur at any time, especially when your immune system is low, or when you're exposed to triggers. Sorry to say, but the fact is that there is no cure for cold sore, but you can prevent future outbreaks by avoiding stress, protecting your lips from sunburn, and keeping them moisturized.
All right, I got it. Will it spread to other parts of my body?
Yes, your question is valid. You should also avoid touching or picking at the sore, as this can delay healing and increase the risk of infection or spreading the virus to other areas of your body or to other people.
I see. Thank you for explaining everything to me. You've been very helpful and kind.
You're very welcome. I'm glad I could help you understand your condition better. Do you have any other questions or concerns about your cold sore or anything else?
No, not right now. Thank you again for everything.
Thank you too for being cooperative and patient with me. I hope you feel better soon. If you don't mind, I'd like to start your clinical observations. Is that okay with you?
Yes, of course. Go ahead.
Thank you. Let me check your temperature, blood pressure, pulse, and oxygen saturation.
Alright. That is the end of your OET speaking roleplay. All the best.
Thank you.
Thank you for watching.